Welcome to the CT Educator Podcast. I am your host, Karina Hogan. I am a registered CT technologist with 20 years of experience and knowledge. I help new CT technologists level up their CT training so that you can become a successful technologist. I'm also a mom and committed to sharing my knowledge and expertise to help you build your confidence, know the CT basics so that you can deliver quality patient care. So let's get into it. Hello. Welcome back, everyone. Welcome back to the CT Educator Podcast. We are starting a new month. So March is here. That means spring is right around the corner and summer is coming. So let's do a little housekeeping before we get into today's episode. I think a lot of good things are happening as far as the show and the YouTube channel. It's getting some, very good traction. So if you guys haven't subscribed to the CT Educators YouTube channel, make sure you do that. All the links will be in the show notes, okay? So, and make sure you guys follow me on TikTok because I am gaining just lots of positive feedback as far as me rebranding that channel and my content and everything. So you'll get like a mixture of both, life stuff when it comes to me being, a parent and this and that, and also all the CT things. Also, I am putting on a live event. Okay, so my live event, I am going to be talking about patient centering. So make sure you guys come to that live event. So I am going to broadcast it on TikTok live. So make sure you follow me on TikTok because that's exactly where it's going to be. So I am going to probably try out some live streaming because since I use Riverside to record all my podcasts, they do have a feature where I think I can stream on all three platforms. So I'm going to have to test it out and see. So if anything, you can sign up for the live event. There is a link to sign up. Okay, get on that email list so you know exactly when and what time. So the live event, I believe, is going to be at the end of March. I don't have the dates off of the top of my head because, my brain can't think that far. But when you sign up on the link on the live event, it'll tell you exactly. It's going to be a 2-day live event. It's going to be at 5 or 6 p.m. CST time, so Central Standard Time, because I live in the Midwest. So make sure you guys sign up for the live event. We're going to talk about all the things patient centering, and I'm going to make sure that you're a fucking badass tech when it comes to patient centering, okay? Because that's very important when it comes to CT, all right? Also, make sure you follow on Instagram because I do post some stuff on Instagram. I'm getting ready to, put out a few polls out there for some interesting content and things that I'm going to put on TikTok and on the YouTube channel. So make sure you guys follow me on all the social platforms, okay? Another thing, this is a little promotional. If you guys are interested in some online fitness coaching, I have a very, very good fitness coach. I personally train with him. Yes, it is my boyfriend. So, he is excellent. I will link his information in the show notes as well. So if you're interested in 12 weeks of coaching with him, he will get you summer ready. He will provide dietary advice and provide all the workouts and the training program that will fit your needs. So if you're interested in that, his information will be linked in the show notes. There will be a form that you can fill out. And make sure you guys come get some personal coaching. He is wonderful. I tell you, my fitness journey, I started on my own because once you get tired of your shit and the mental drama and the mental bullshit, you do something about it. So I did. And I had been working on losing weight and getting my body with as much muscle mass as I want because that's just how I work and that's just how I am. Before I started working with him and before we started dating. So he is excellent. He will get you in summer ready shape. And because he's in excellent shape too. So he will kick your ass and make sure that your form is good. So if you're interested in that, make sure you guys check out the show notes. His information and his links to his socials will be on that page, and there will be a form to fill out as well. Okay. Now, let's get into today's episode, shall we? So in this week's episode, I figured we'd talk about how to conquer the first 90 days when you're working in CT. Okay. Now, as CT technologists, we face a lot of challenges, especially when you're new and you're starting out. I was a brand new technologist at one point, and I knew I had the same struggles that you listening. If you're new, you probably are experiencing it right now. Okay. So what do I talk about the challenges? So the biggest challenges, and these are a few that I kind of noted, is workflow, protocols, IV skills, setting up exams correctly, and patient positioning. Those are all things that we struggle with. And making sure that you're doing this right. And, you're going through all the proper techniques. You're memorizing protocols, which there's fucking a lot to remember. And no human being can really remember everything, right? So that is the thing that really hampers down, and you have to learn how to do these things. So I'm going to give you some pointers and some key concepts in this episode on what you need to know in your first 90 days as a brand new CT technologist. Okay. So those are the core things. So I think what is very important is to make sure that you know the workflow of how CT operates, where all the supplies are. And I know I've talked about this on previous episode, but I'm going to drill this into your brain so you are aware and okay? So those are the main things, like how does CT operate as a department, policies, procedures, the different things that you need to have on hand when you set up those patients, right? For their exams, what to look for in charts, labs and IVs, prior imaging, allergies, things of that sort, which you have to be familiar with, okay? And then positioning the patients. I can't stress enough, and that is why I'm teaching a free live event on patient centering. Patient centering is very, very crucial when it comes to CT because it affects your image quality and the amount of dose that is getting administered to the patient. So you have to make sure that you learn these correctly. So I always stress to my new technology, use your laser light. That is what it's there for. That is your guide. Okay. And I know there's a lot of technologists that say, oh, well, you just do this and this. No, stop the bullshit. Okay. Do not fucking do that because that's not going to help you. Use your laser light. That's what it's there for. Okay. When you do that and you apply those principles correctly, you're going to have better image quality. There's a better outcome for the patient, and you're going to be a better technologist because you know how to do it right the first time. Okay. IV skills. This is a big one for most people. Okay. This is my take on IV skills. Until you continue to do it and get more comfortable and repetition and consistency, that's how you're going to master that skill. Nobody from the very start is going to be competent in IV skills. You're going to miss a lot of them. I know I did. Okay. However, let me share this with you. When I started doing IVs, I was trained under a nurse who had been a nurse for 30 years. Like she was an ER nurse, she was an ICU nurse, she was a pediatric nurse. She worked in all levels of nursing. Now, she teaches at one of the largest universities in my home state of Nevada and teaches nurses how to do things. And she taught all the IV classes at the hospital I worked at. So what she used to do is she used to give me all the hard patients, all the patients that were chemo, had no veins, dialysis, you name it. And for a long time, I thought that she hated my guts, and that's why she kept giving me all these hard patients. So one day I said, hey, you give me all these hard patients I continue to miss. Like, why are you torturing me? Why are you doing this to me? And she says, the reason I'm doing this is because I'm making you a better technologist by making sure you know exactly how to put these IVs in. And that when you get a hard patient, you're not going to freeze up and think you can't do it. That stuck with me. And so the next patient I had was patient who had rolling veins, chemo, was on dialysis, you name it, the patient had it, got that 20 gauge in the AC, no problem. Okay. Now, that's not to say that you are going to get that every time, because there are going to be days where you're going to miss, and that's okay. That's perfectly okay. You can't get them all every single time, right? But consistency, repetition, and just ripping the Band-Aid off and saying, you know what, I'm just going to continue to do it to perfect my skill is going to make you better at it. Okay. Now, when it comes to protocols is a very complex thing because there's so many protocols in CT that we have to learn, so many things that we have to master, so many things that we have to know, and so many things that we have to set up, and making sure, there's recons to everything. There's so many window levels, soft tissue and bone, 3Ds that have to be done, and MIPS that have to be done. So what I always encourage in the first 90 days is to make sure you carry a notebook with you. Write things down. And every department in every state around the country should have a protocol book that you can refer to and you can look at, and that you can familiarize yourself on how these protocols are set up. Okay. Which ties into my next point, into setting up exams correctly. Making sure that your box or your lines are where they're supposed to be. So, for example, if you're doing an abdomen pelvis with contrast, you want to make sure that your starting point of your scan is above the diaphragm, and then your ending point is at the lesser trochanter so you don't cut off the rectum, right? So you have to make sure that all the important anatomy is within that box or within those lines. And then, your scan field of view, making sure that that covers everything, right? So I always encourage everybody to have a notebook. I've had techs who do note cards, and they take note cards everywhere. I've had techs who, bring iPads, because now we're in a digital world and that's just what it is. So whatever it is, because your brain cannot retain all the information that is needed to know in CT. You have to remember, CT is an advanced modality. You cannot, for the life of me, cannot remember everything that there is to know. Okay. Now, those are some of the very key concepts that you need to know within the first 90 days. And in the show notes, I do have an 8-week checklist on what you need to know as far as, navigating through that first, 2 to 3 months in CT, so that you can have a better understanding on how your training should go. So make sure you download that checklist and apply it to your training. Now, I'm going to stress the importance for success when it comes to your first 90 days is coaching and mentorship. Here's a little bit of a hot take, and I know I'm going to really trigger a lot of you that listen to me. I feel that coaching and mentorship is not executed in the CT programs that are out there. I'm going to say that again. I do not believe, and I do not feel that there is coaching and mentorship in the CT programs that exist out there. And those are two pieces that are very important for success. And that's why I've built a coaching program around those things, because those are things that are important. Those are things that you need to give those techs the constructive feedback. You need to give them that positive feedback. You need to make sure you correct the mistakes if you continue to see them, and making sure that they don't harm patients. I have designed an entire 6-month program because I feel technologists who are new need that 6 months to really get the basics down and really just hone in on their skills and really perfect on how to execute these exams. Because we all know it's not just about passing the registry. Passing the registry doesn't make you a better technologist, which I am going to talk about that in a future episode, okay? It really does not, okay? So my program helps you achieve the core concepts of everything you need to know for CT, what you need to know in your first 8 to 12 weeks of training, okay? It also sets you up for the common exams, because you have to know the common exams, like your heads, your PEs, your abdomen, pelvis, all that stuff, okay? And to mentor you and coach you through the times where you feel like, I'm not confident in doing this. I don't know what the hell I'm doing. I don't know where to start. Those are the core pieces of my program. And that is what I've built my 6-month program around. So if you're interested in joining my program, make sure you check out the show notes and come join the CT Educator program, where I will coach and mentor you for 6 months and get you to the path of success. Okay. So that is it for today's episode. I hope that all the points that I've given you in this episode are helpful. Okay. Also, if you have any questions, please don't hesitate to shoot me an email. My email is always open. I know sometimes it takes me a couple days or so to kind of get back to my emails. I do have a full-time job and I am a mom. So I am doing more of a due diligence to make sure that I get back to everybody in 24 hours. Or you can shoot me a DM on TikTok or on Instagram. I'm on both. And let's get you to the path of being that awesome, successful CT technologist. Okay. So make sure you come to the live event. If you need online fitness coaching, make sure you check out my boyfriend's page. I will link everything in the show notes. So thank you so much for listening and joining me on this episode. And I will chat with you in the next episode. Thank you for listening to this episode. If you would like to share your CT experience, have an interesting story to share, or need help in your CT training, please email me your questions at contact@thecteducator.com. Follow along on Instagram at the CT Educator, also on Facebook at the CT Educator. Don't forget to like, share, leave a 5-star review, as this will help support the show and it'll reach all of you that need guidance. Thank you for listening and happy scanning.